Hey everyone, and thanks for tuning in. We have Alberta. We have a Minister of Health, Alberta Minister of Health, Mr. Shandro here with us. Hi, Minister Shandro.
Hi, how are you? Thanks for having me.
Good. Thanks for the technology we have, so we can have you here. Thanks for giving us a time off your busy schedule. I'd like to start quick questions about the announcement that I heard today from the federal government about the starting of receiving the vaccines start next week. Is there any plan for Alberta to be part of the next week distribution, or are we going to stick to Premier Kenney with his announcement of this like January distribution?
Well, even what we announced last week was just from the information that we were getting from the federal government. So it was all contingent on them and the approval process. So it looks like they have expedited the approval process right now for one of the vaccines, the Pfizer one. But
Right.
look, we're ready. We're ready to receive and distribute the vaccine whenever the manufacturers can get it to us. So we're happy to go faster if that's the case.
So far, there's no plan for December to receive any vaccines, I take it.
Oh no, we could. We totally could. We have the freezers in place. We have the transportation network in place. Everything on our end is in place. We are doing a dry run on I think it's Wednesday or Thursday,
Right.
just so we can do a dry run and pretend to have received a shipment from Belgium. But it sounds like there may be, after that dry run, a shipment that comes to us a little bit earlier, and which is great news for us. But that's
Right.
all always been predicated on the feds.
Oh, I see. Well, hopefully we're gonna finally start to hear some good news coming out of Alberta, Minister, because as you know, for some reason, since we launched the Phase Two recovery plan in Alberta, and I think this is my own observation, since that time, for some reason, our numbers start to go skyrocketing. So, do you think our Phase Two plan was it? Is it fair to say it was a failure, or was it just like something you expected it might not go well in Alberta?
Well, no, because phase two started back in May, right? So we
Right.
we launched into to stage two of the relaunch strategy back in May. And we did know that starting in the fall, throughout the entire world, we're going to have increases in case numbers, and we made a commitment to Albertans that, as you know, throughout stage two, if we ever go to stage three, or as we went into another wave, we're always going to be making decisions that are going to be based on the best evidence available, which is exactly what we've done. And the data recently has been that the concern is with spread and in social gatherings, which is why
Mhm.
the new measures we announced about 12 days ago was exactly to address that, as well as some other concerns we had with our spread.
Oh, I see. So I'm just trying to ask that question because I'm trying to justify why in Alberta here we're like one third of the population of Ontario and almost half the size of Quebec, and just about below BC a bit. Why we have such a high numbers? I'm just trying to justify it in my mind, in my head.
Well, as we have to remember that those other places have had increased spread previously throughout the pandemic, and so right now we do have higher case numbers than they do now. But we also have to remember that that we haven't seen the overall impact here in Alberta that they've seen. So, for example, the total deaths here in Alberta is 615, and my heart goes out to all the people who have suffered from COVID, those who have lost loved ones as a result of COVID. But you have to compare that to Ontario, where they've lost over 3,700, and in Quebec it's over 7,200 in total in
Right.
Quebec. So I think their death rate on a per capita basis is like over 6 times as ours is right now. So yes, we are in the middle of increased cases right now, and that's why we need Albertans to take these public health measures seriously. But we thankfully haven't seen the overall impact that Ontario and Quebec have seen.
Oh, I see. But I mean, I was like 45,000 test was done in Ontario versus 20,000 or so, 23,000 yesterday in Alberta, and it's almost almost the same active result. I'm trying to understand. Maybe they failed in the past, but obviously they took some measures. That's why we see better numbers coming out of these provinces versus Elder very concerned about Alberta and trying to really justify why this is happening. Was it their policy that was not working, or people just not cooperating, or something went wrong in Alberta? And that's what I'm trying really to understand myself.
Well, look, I think it's important that we don't blame anybody, but it is going to be a function of how closely people want to reduce their social interactions, right? And if we see increases when people are going to not limit their social interactions, I think people starting in the fall, as we saw very few cases in the summertime, and people did have that fatigue, unfortunately. We
Right.
have to have people buy into the public health measures for them to be successful.
Oh, I see. Okay, Minister. With the a week ago, or maybe now 10 days, we start to hear a lot of reason, or the main reason for this spike here in Alberta is the social gathering. And I think this is one of the main restrictions that the government forced, is eliminating the social gathering. The 40%, according to the government, coming from social gathering, which is we're going to stick by that. The question is, what about the other 60%? Where's this 60% come from? If you have any statistic about the other 60%.
Well, remembering, if we go back to March, right? So when we knew there was a case, and
Hmm.
somebody would test positive because they weren't feeling well, they get tested, and we say, so where were you the last 10 to 14 days? And a lot of times those people say, well, I was out of country, and we would be able to very quickly assess, great, it was because of travel, you were outside the country, or because you went to work with somebody who was out of the country. It was very easy for us to be able to figure out, because people did have a lot less social interactions. But now that people go out in the community, we say, where have you been the last 10 to 14 days? A lot of people aren't able to give us very accurate information. And so sometimes it's difficult for the contact tracer to say, we know for sure it's from that person, or it's from that social setting, or it's from that workplace setting. It can be very difficult for our contact tracers, because people are interacting so much right now this fall. And so that has been a little bit of the difficulty in being able to narrow down if it came from where the spread came from in the community.
Oh, I see. And so far the restriction, I mean, we're almost 12 days since the new restriction started, or 10, 12 days. Is there any signs from your end that things are start moving in right directions? Because we still see, I mean, the numbers keep climbing up and up here in Alberta, and the number of deaths, same thing, it is going up and up. So far, is there any sign that things are moving in right directions?
Well, you're right. So the new restrictions were announced on the 24th of November. And a lot of those new measures started to be implemented on the 27th of November. So the virus has a 10 to 14-day incubation period, which means it could take 1 to 2 weeks from the start to see the impact of any measures. We have been watching that closely. We're going to continue to watch it closely. We are concerned with the recent rise, as you've pointed out. I don't see, since those new measures, anything being reduced yet. And so you're right. That is a concern for us. We are going to continue to watch those cases. We're going to continue to work closely with our Chief Medical Officer of Health, Dr. Hinshaw, and as well as AHS, to look at that information. And we told Albertans we were going to do it at least before December 15th. But we're looking at the data closely. We'll continue to do that as we review it with Dr. Hinshaw and AHS.
Okay, well, we still have to wait till another week or so before we can get a public response or evaluation for the plan so far. But as I said, it's
Well,
very
at the latest.
discouraging, the results at the latest.
Yeah, at the latest.
Okay.
We just wanted to give Albertans at the latest. But I don't at this time see. We also talked about the R rate, and we wanted the R rate to come down below 1. And the public health folks said they would want it from these measures to see it go to at least 0.8. I don't see it increasing in this time. So this is one of the things that we're reviewing with Dr. Hinshaw and HS.
Oh, well, Minister Shandro, if you don't allow me, I do have quite a few questions coming in from people directly. But before I take these questions, if you like to respond to it right away, or we can postpone it for one more question from my end, which is I'd like to ask you about the enforcement.
Sure.
Are you, as a Minister of Health, are you satisfied how whether local municipalities or the provincial government set the tone for enforcing these restrictions? I mean, do you think the government set this? I mean, we have a plan, an emergency plan for health emergency plan, but the enforcement, it's in a way, it doesn't sound that strong when the premier is saying we do have to protect the individual right, which is this is our fundamental right, and also we do have to look after the interests of our like local businesses and stuff. But the other hand, we want to do this restrictions. So quite a few people, which we've seen in Calgary and Edmonton and other places, they are not really taking that restriction seriously. They are breaking the laws, or they are not just not believing and this is the right direction. So are you satisfied with with enforcement? And if not, what's need to be done?
Well, I think throughout the pandemic, it has been a balance. We don't enforce as government, right? So the enforcement is left to our public health officials, as well as there have been times during the pandemic when bylaw and police have also been involved in enforcing. AHS has shut down a number of businesses when they've come into a business and they've seen somebody not following that. So there have been a number of instances where AHS has shut down a business. Now, I think when it comes to enforcement of any law, it comes down to what you're trying to do is change behavior. Now, you can change that behavior through enforcement, but there are other opportunities as well. And so sometimes you have to look at why did somebody ignore following that law, and is this a situation where we can teach, can we educate, can we intervene with some other type of measure, can we prevent with some other type of measure? So prevention, intervention, education are also tools, as well as enforcement, and we need folks who have that have that training and have those skills on how and when to enforce, to be able to do that for us.
So as a Minister of Health, are you satisfied so far about the level of enforcement, or that's the best we can do as a province? Personally, I should
well,
say.
I know the AHS and their well, I have faith in our public health officials. I support them throughout the pandemic. I want to make sure that they have the resources that they need, and they have the tools that they need to be able to respond to the pandemic. That includes enforcement. I don't want to be intervening myself in decisions about enforcement. So I'm going to leave that to the people who have that training and have that expertise to make those decisions.
All right, that's fair enough. In my last conversation with Premier Kenny, I asked him about the worst case scenarios in terms of in terms of ICU beds, and if the government is ready for worst case scenario. God forbid if it happens in days and weeks coming forward. So I just he mentioned something to me that says in line, like some of these numbers are not really true and been hyped by some media, and he give us an example of we're not even at the full capacity, we're below average in terms of usage of ICU bed. Are you in line? Is that something also you agree with? Do you think there's a little bit of hype taking place to hype up these numbers and make it sound like or get this situation, get people more an edge in terms of government is not doing or not prepared for worst case scenario?
Well, I do absolutely agree with Premier that that the capacity of our hospitals is our primary concern when it comes to making sure that people are following the public health guidance. That is a concern for us. So it's not even necessarily the case numbers, but it is our hospitalizations and our ICUs. Absolutely agree. And He's absolutely right when he says there has been a lot of fear mongering about our case numbers, about the situation in our hospitals. But now we have seen over time increased stress, increased pressure on those frontline workers. We have 100 hospitals. There have been many of them who've never even seen a single COVID patient throughout the entire pandemic, but our 16 largest, where a lot of our ICUs are, in Edmonton and Calgary in particular, they are those folks who are working in the ICUs are under a lot of stress, under a lot of pressure. Part of it is because we are continuing to want to make sure we have the capacity to continue to provide the surgeries that Albertans need. Remember that there are many provinces who've just canceled. At one point, Ontario went down to 10% of their surgical capacity during COVID. We've kept up, and right now, I think we got throughout the summer, Edmonton and Calgary back up to 100% of their surgical capacity. So that also creates a lot of pressure. We will see as cases rise, we will see people in Edmonton having to have some of their procedures being postponed as a result of the increased pressures in the hospital system. That is absolutely true. And that does give us concern. And we're going to make sure, first of all, though, that everybody in this province that needs critical care will get the care that they need. Our hospitals are going to stay open. Yes, this is difficult right now. We thank our healthcare workers for being able to provide that care. We're going to make sure that AHS has all the resources it needs to respond to the pandemic. But yeah, there's pressure now, and there's going to be pressure in the days to come. But we'll make sure that AHS has those resources to respond.
Oh, unfortunately, the situation in Alberta, as we all agree, is not getting any better. And there's a blame game taking place, like who's supposed to be responsible for that. But as a minister of health, I think you do agree with me when the number keep going up and up and up, and people might start to act differently, respond differently. And I think that's an understandable reaction because the frustration is very high. Minister, I do have other questions. If you still have time for me, so you can pass a few of them, if that's okay.
Of course.
And
Sure.
again, I'm gonna start with this question that directed to you from Turab Hassan said, "Stop privatization of a." I think the question is right there. Stop privatization the healthcare. I mean, I hear this all the time about our Minister of Health. Is this what's your thought of, what's your response to this accusation? Is that something you're really trying to privatize healthcare?
No. And first of all, I point this out. Our healthcare is publicly funded, 100% publicly funded. And so if it's publicly funded, I don't think it's private. I don't think it's privatized. And I would point this out to Turab, is that think of our 11,000 physicians. They're not employees. They are independent businesses that provide those physician services to our patients. Now, when I walk in to my doctor's office, I don't call it a private clinic. And I don't call it a private office, because when I walk in and I walk out, I'm not paying for anything. So that clinic is no more a private clinic than the opportunity that we have for surgical facilities. And remember, we already have 43 of them who do those surgeries. They're integrated with AHS. They're managed by AHS and contract. So I think to a great extent, this is people who are really just fighting against non-unionized workplaces. And I think we have to remember that healthcare needs to be provided, and there's going to be some workplaces that are unionized and some that are not. And our goal, though, is just make sure that the number one priority is the patient, make sure the patient gets those services.
Okay, Minister, and I do have another question here. I'm trying to find it so I can post it, but is about why our province, our government refused to be part of the national program in terms of apps. To refuse to allow that apps to be accessible here in Alberta to trace COVIDs and stuff. Why Alberta's out of that program?
Well, I think the most important word you asked there in your question was the word trace, because the
Right.
federal app is not a tracing app. And that's been, I think, unfortunately, the confusion for people, that they've heard a lot of people referring to it as a tracing app, and it's not. It's a anonymous notification app. And so the concern that our Chief Medical Officer of Health here in Alberta, Dr. Hinshaw, as well as in BC, the concern they have is that it's not actually helping our contact tracers. Our app here in Alberta that we've implemented, based on apps that have been used in Singapore and the United Kingdom, actually is a tracing app. But the federal app is just sending out anonymous notifications. And then the concerns our public health folks have is that is just going to send more folks to the testing system, without without somebody assessing, without a contact tracer trying to figure out whether they should be tested or not. And so it would stress the system even a little bit more, and having a lot of inappropriate testing. That's the concern they had. I took their advice. I listened to them, and very happy to get their feedback in that decision.
And I have these questions from Rima. Are you planning to make the vaccine mandatory? Is there anything in the? I heard the premier saying is he's gonna even change some laws next year to not allow the government to force vaccinations upon populations. So where you stand on that, Minister, in terms of a vaccination? Do you think mandatory vaccination is something that you're in favor of, or you think it's still a personal choice?
Well, thank you very much, Darima, for the question. I would point this out that, as I said before, we are not going to tie people down and stab them in the arm. Look, vaccines are safe. Vaccines are effective. I take my flu shot every year. I plan, me and my family, in getting the COVID vaccine if and when it's available to us. But we are not going to force anyone to get a vaccine. I take vaccines, not even just for me, though. My parents are getting older. We've had 2 newborns in my family. My brother and one of my cousins have had newborns. I take my vaccines to protect the ones that I love and protect my community and to protect healthcare workers. So that's why I take it. I hope all Albertans will take the vaccine, but we're not going to force it. I think, though, the Rima also asked a question about the difference between hydroxychloroquine and the vaccine. I just point out hydroxychloroquine as a treatment if people get it, right now I listen to physicians. Physicians are going to decide what the treatment should be, whether it's remdesivir, which is I think a lot of the evidence is showing is effective for treatment, and hydroxychloroquine. Let the doctors figure out what the right treatment is, but it sounds like remdesivir is the most effective treatment that our doctors are using.
I do have, as I said, not many questions, but I do have to respect your time as well. I'm gonna end with a few 2 questions, if that's okay with you. And when it comes to
Oh, sure.
past, let's say, let's talk about, if you can just walk me through, if you can, December 16. Things are not going well. The number is still in the 2,000 and up, and the death is still all that. So what do you expect? What do you think we should expect? If you can give us just a hint of what might take place in case restriction did not work the way you wanted. Is that something you can share with us?
Well, I think it's a matter of first. Well, I think it's going to be a matter of us getting the recommendations and sitting down with our public health officials. So we haven't done that yet, but once we are able to sit down with them and hear from them where they think the concerns have been, if there are concerns since we announced the past measures. So where there might have been decreased spread in our community, where there might have been increased spread, but it's got to be, as we've said all along, since May, that the measures we have will be based on the evidence. That will try to minimize business disruption, but it's got to be based on the evidence, and it's got to be based on the advice of our public health folks.
So a complete shutdown like we witnessed in March and in April, is that something possible still on the table?
Well, we didn't have a complete shutdown. We didn't shut down offices. A lot of offices made the choice to allow their employees to work from home. We didn't have people sheltering in place in Alberta. We did have restaurants and retail closed, but we didn't shut down places of worship. We didn't shut down manufacturing or construction. And so it wasn't, I don't think, a complete shutdown, but it was sufficient measures. If you look at our numbers in Alberta in the spring, people took things seriously enough that we limited the spread as a whole, as a community, as a province. And so what we need is measures that will make people take this seriously and start limiting their social interactions.
Okay. So is it fair to say the worst is behind us, or we're still in the middle of it, based on the vaccine's arrival, based on all the other steps?
Well, the vaccines, just phase one, is going to be going from whenever it lands in Alberta to the end of March. And I think through that, we're hoping to get maybe approximately 400,000 of our healthcare workers and most vulnerable vaccinated during that 3.5 month period. But we're really going to see still cases in our community if people are not reducing their social interaction. So there will still have COVID for many months in our community, but we hope that in this first phase, we can at least start reducing the risk to the most vulnerable in our community. Because we haven't seen, thankfully, any spread from patient to healthcare worker, but we have seen healthcare workers sometimes, and not on purpose, of course. Our healthcare workers are doing an amazing job protecting themselves and their coworkers and our patients and the residents in long-term care, but sometimes it does inevitably happen. So we'll hopefully, with phase one, be able to start taking steps to protect at least the most vulnerable.
Minister, I really appreciate the time you gave me, and especially with this kind of a platform where you have a direct interact with so many people out there. And I can see, looking at the questions, some of the questions are a little bit tough for me to say, but I do also I have to be transparent with you, and I ask you. I'm sensing there's a lot of blame going toward a Minister of Health in Alberta, and that happens to be you. I mean, is there anything that you would like to respond to those people who would say, the Minister of Health did not do the job that it should be? And I do apologize for if my question is appropriate.
No, it's fine. I'm happy to take questions from anybody on anything. But look, we developed a plan. And the plan has changed based on the evidence throughout the pandemic. And that plan is worth almost $2 billion. And it includes measures to support our folks in our hospitals, to our healthcare workers, the 300 continuing care sites to protect the most vulnerable. It's almost $2 billion that we have spent so far in being able to respond to the pandemic. Now, of course, we knew that at some points throughout the pandemic, there are cases rise and cases fall. We're right now in a time when cases are increasing. But look, my job is to make sure that our hospitals and our healthcare workers are supported. They have all the resources that they need. And I'm going to continue to make sure that that's the case, and as well in our continuing care settings too.
No, perfect. And I really appreciate taking that questions. As I said, there's some harsh words out there. But again, being transparent and talking to people directly, that's the best, in my opinion, that's the best response to all these people that saying that your department did not do the job that's supposed to be. But I'm gonna before I give you the last word to say, if you want to say anything to Albertan, any plan and at what stage the vaccination, or you might allow vaccines to arrive at schools, mainly teachers, because I mean the plan is to get for seniors and most vulnerable, 60 plus, and health workers. But what about teachers mainly? My questions: at what point the vaccine will teachers will have that options to take vaccines?
Well, we haven't decided even who is going to be the priority groups in phase two. Right now, we've just decided for phase one. We made the decisions about phase one. So it's starting with the most vulnerable in continuing care, especially like the folks who are in long-term care, the healthcare workers, especially the healthcare workers in our ICUs. And then we're going to be providing it to community seniors, including those who are in seniors' homes and living at home. That's what we've been able to communicate to people so far. But when it comes to phase two, I think we got to see who is and isn't accepting wants to take the vaccine in phase one, how much vaccine we're going to have in phase two before we can make those decisions about who is going to be getting into phase two.
Perfect. Minister, I really appreciate your time. If there's anything you'd like to say before I wrap it up, and thanks for being here with us. And on behalf of all the people here, thank you, Minister. So if there's anything you'd like to say
Well, thanks,
to
Sam.
Albertans.
Well, sure. And I'd say this, Sam, just to everybody listening, is that to remember that very quickly in the pandemic, while the rest of the world was running out of and not able to test, and people still not able to test, provinces have given up completely on contact tracing. Yes, our contact tracers are overwhelmed right now, but we have built up our contact tracing system. I think we have the most robust testing regime in the country because we invested in hiring those folks. We invested in those machines. We bought the reagent for the testing. So we have to depend on the US and depend on other provinces. While the other provinces ran out of PPE, we were so prepared, we actually had the ability to donate PPE. And as well for our surgeries. Yes, our hospitals right now are stressed, but a big part of it is because while everybody else has been canceling surgeries, we've done our best to make sure that people are getting the care that they need, surgeries and mental health supports, so that we can make sure, because this is an incredibly difficult time. I know that people are anxious right now with the case numbers going up, and that can be felt. That people feel that stress, they feel that anxiety. But right now, I think people have to remember that AHS and the folks in our hospitals are doing amazing work, and amazing work to make sure that we do have the tools, we do have the capacity to respond throughout the rest of the pandemic. So my thanks to them, all the folks in the front line, all the folks in the hospitals, all the folks in the assessment centers. Thank you to them for all the hard work that they're doing to make sure that really, I mean, going back to our comparisons to Ontario and Quebec, that our numbers are so much better than Ontario and Quebec.
Well, hopefully we're going to hear that today, and days that to come forward, numbers are start to come down. Thank you very much, Minister Shandro, and hopefully we'll see you after the vaccines start rolling out, and we'll be chatting more and more. Thanks for everything you've done, you and your staff, and the everybody's in the Alberta Health Services. Thank you very much, Minister.
Great, thank you. Thanks for having me. Bye, Sam.
Bye-bye. So that's it, my dear friends. Thanks for being here and for asking these tough questions. I have to apologize for some of these questions that I just can't ask blunt questions like that. So I have to still, I mean, the minister put himself available for questions and stuff. So some of the questions really hard even to read, but thanks for tuning in. And if there's any ideas and any suggestion for me, would you please share that with me? Our goal is just to be informed and also to have a saying of what's going on out there, and make sure our elected officials, they know that we are listening. That doesn't mean we're watching, we're listening, we're evaluating what's going on, and we have our own way of understanding what's going on. But anyway, time is tough, and hopefully we're gonna pass this COVID crap. Thank you very much for being here with me this afternoon. May God bless. Assalamu alaikum wa rahmatullah. Peace be upon you all. Assalamu alaikum.